So a few days ago in Uvalde, Texas, 19 elementary school kids are killed and 2 of their teachers are killed, and all of those families, and in a significant way, that community has changed forever. And of course, that brings the topic of the weapons used, but it also brings the topic of mental health to part of this discussion. I want to say a couple of things about that. One is the last day of October 2013, Senator Stabenow and I had a piece of mental health legislation. We went to the Senate floor and we talked about the last bill that President Kennedy had signed 50 years earlier, 50 years before that date, and it was the Community Mental Health Act. And we went through the Community Mental Health Act, and when we did that, it was obvious that that act was designed to close a lot of facilities that probably needed to be closed, but it was also designed to create a lot of alternatives that never quite got completed. And so for most of that 50 years, the local police and the emergency room have become the de facto mental health system for the country. That's beginning to change, but it can't change as quickly as we should want it to change. You know, we have 41 states now that are part of a program that we developed in legislation we were also talking about that day. 10 states fully in the certified community behavioral health clinic program, and making a difference in those states, and will make a difference to people who are thinking about harming themselves or others. And I think we ought to look at that as one of the things we figure out how to take more advantage of. But even more importantly than that, I'd want to say that everybody with a mental health problem is not dangerous. In fact, people with a mental health problem are more likely to be the victim of a crime than they are the perpetrators of a crime. And while we have this important discussion about mental health, we don't want to do anything as a society that would discourage people from stepping forward and saying, I have a mental health problem and I need help. The National Institute of Health says 1 in 5 adult Americans has a diagnosable and almost always treatable behavioral health issue. We can't give 1 in 5 adult Americans any reason in the world, or all the kids that have mental health challenges after 2 years of COVID and isolation from school. We can't create an environment where any of them are hesitant to step forward because they see themselves as becoming part of a class that's seen as dangerous. But that doesn't mean that mental health isn't also an important part of what we need to do to deal with people who are troubled. And when you deal with people, almost all of these cases involve not just somebody who's decided to do a terrible act involving the lives of other people, but it's probably also almost always purposely decided that this is a way for them to end their own life. And so whether it's suicide or homicide, we need to be stepping in there, but we also need to have a mental health system that people aren't afraid to be part of. And the balance of that in this discussion, I think, is really an important balance to be sure we try and achieve.